Southwest Florida, welcome back to Leap Pitch Live. We're here at the Children's Network of Southwest Florida. We actually got the sign working, folks. The accommodations have just been outstanding. This next 3 weeks here, you've seen us last week. Next 3 weeks, we'll still be here. We're bringing you interesting shows. Got here our friends from McGregor Clinic who have the most important job in all of Southwest Florida, David and Amy, and keeping us educated and not letting us fall asleep at the wheel. Let me start off with this one right off the bat, David. Magic Johnson is not cured from HIV, right?
Correct.
Now, Magic Johnson has HIV or AIDS.
Magic Johnson is diagnosed with HIV.
Okay.
And the difference, the reason many people in our societies assume that he is actually cured of the HIV is because of false information provided through media. The situation with Magic Johnson is no different than many of the clients we serve. He is virally suppressed, or what many people know as undetectable, meaning he's still HIV positive, but the viral load is at a place where the doctors can identify it as virally suppressed.
I see. We always want to keep getting that out there, Amy, because that could always create a misnomer. Amy, I want you to piggyback on David and say, when I hear people talk about the cocktail, what is the cocktail? Is that what Magic Johnson is taking?
It's actually what the majority of clients are taking.
Okay.
Magic
Johnson is getting no better services than clients who come to you.
Absolutely not. Exact same stuff.
No matter how much money you got.
Regardless.
Okay.
Absolutely.
Right.
Absolutely. So money's not a barrier. But what it means by cocktail is you're actually taking HIV medications in combination to attack the virus at different points where it's working on a cellular level. And the great thing is, way back when...
level. You
well,
killing
come
me.
on,
Like
man.
Mr. Spock.
You said that was the best.
Cellular level. Okay, let me act like I know what that means. Let me act intellectual.
Oh,
really?
cellular level. Yes. So what's happening is when HIV attacks the system, it's attacking in different ways. And so these medications combine as the cocktail to be able to attack it so that it will not replicate, so it will not make copies of itself. And it used to be that you had to take multiple amounts of multiple pills. Today, it's one pill once a day if you're treatment naive, if you've never been taking any kind of medication.
Now, what have been some of the developments around the world in HIV prevention?
One of them is the fact that we're down to one pill once a day, which is phenomenal, and it has little to no side effects. So
now, in your early days, because I know you used to come on our show, 15 years ago. Did you ever foresee this would ever come?
We hoped, but we really didn't know that it was coming.
Okay.
But there's more to come. So right now, scientists are working on long-term injectable medication. So similar to Depo-Provera for pregnancy prevention, you would get a shot and not have to take medication daily. Because for a lot of our clients, it's hard to take a pill every day. I don't even take my vitamins every day. So a life-threatening medication, you need it. You need to sustain yourself. And so they're trying to find ways to make it easier for people to be adherent.
Not to be confused, David, with you don't need to get tested.
Correct.
Emphasize that.
Yes, it is very important for individuals to be tested. When you have a cold, you can often assume maybe you have a common cold or maybe you have the onsets of pneumonia. The difference there is with HIV and knowing your status, the only way to know a confirmatory answer to that is to be tested. And through the years of medical research, we're now in a place where we offer rapid HIV testing. Rapid HIV testing we offer it through our services at the clinic when we're doing outreach events. We're typically out in Southwest Florida offering this service, and the result is made available to the client in 15 minutes. The client is no longer waiting the 2 weeks and their minds are going all over the place. Within 15 minutes, we can read an accurate result.
I'm glad you mentioned that because I'm gonna say this on air because you guys heard me talking about off air how when I go to the doctor and I get my blood work, my tests, and I tell them to go ahead and do the HIV test and how I have to wait, and sometimes it makes me like, I don't really want to do that. So this substitutes for that now. You don't have to wait as long.
You do not.
But let's say in the real world, so you get your results back, is there some counseling that's right there? I think I've seen that on TV on CSI or something where they have somebody who counsel you right on the spot.
Yes,
we really get
Absolutely. We are trained to offer that counseling in the event a person is negative or positive. Oftentimes, the client may walk in ultimately assuming that because of their risk factors that they may be positive. And in the instance that the individual result is a positive or reactive result, we are prepared to have those conversations. And for those that test negative, we encourage them to be cognizant of their sexual activities or even their drug addictions to ensure that they're doing the things they need to do to prevent the latter of us reading a positive result.
Glad you mentioned the drug piece, because sometimes that slips through the cracks, doesn't it?
It does.
Elaborate on that, Amy.
So what actually puts people at risk isn't being high or being on the drugs. It's actually needle sharing, the exposure of blood-to-blood contact. And so often people forget that sometimes the works may have blood components. They forget that needles, when you're high, you're not thinking about, I just want that hit. I'm not thinking about, I could be passing something, or somebody could be passing something to me. And so often people don't even consider that a risk factor. And then they come to us and we're able to talk to them. And the counseling that we do actually includes risk reduction. So let's talk about, I can't get you off of that overnight, but maybe I can help you reduce your risk for HIV and other STIs.
And I've had a couple of college buddies, years have passed since, when I was in college, there was no such thing as HIV or AIDS, but over the years they were into drugs in college and they died from the needle infection from HIV. And before it was like really popularly known after Arthur Ashe, who was my role model as a kid, died. And I guess I'm thinking it was the Arthur Ashe thing that made people start checking. Well, Arthur Ashe had that blood transfusion thing, right? But there were some other people with the needle. Okay, let me stay in my lane here. Why are minorities? Well, let's don't go into why are minorities disproportionately affected, but what is being done about the minority community that is disproportionately affected?
Yeah, I'm glad you corrected that, yeah, because the why, I don't think we can answer.
They'll be here all day.
But we're doing a lot. We actually just applied for a grant and are hoping to get what we call a community health worker, who would be somebody prominent in the minority community, well respected, who is able to get into places that we perhaps have not been able to get into, to reach people who are at most at risk, to be able to assess what their sociocultural needs are, to be able to bring that back to the powers that be, the clinicians, the ARNPs, the Sharon Murphys, to bring that back so that we can overcome the barriers, to be able to get rid of those disparities in minorities.
The education, like I see David, I see you guys like getting down in the grassroots communities, you're going to community events and you're sharing this information in what I would consider a soft way. You're not like lecturing to people, but you get that material. How effective is that, David?
The presentation of the educational components and community engagement has proven to be phenomenal. First year, Amy and I were basically planting the seed and watering, and now we're starting to see the fruit of our labor. We have collaborations with agencies such as Hodges University, FGCU, FSW, and even some of our smaller local community groups that allow us to come in and have 1 hour or 4 hour presentations to educate their staff.
How do people partner with you?
They can simply reach us by going to prevention@mcgregorclinic.org, and either Amy or myself will respond to them within 24 to 48 hours.
Tell us about the new mobile unit. That sounds pretty fancy, high-tech stuff, even like at a cellular level.
Yes, we are excited. We're excited. Within the next week or so, we should be getting our custom-made mobile testing unit. It has 2 full counseling rooms, along with a draw chair for when we hopefully in the future expand to do STI testing out in the community, so that we can do gonorrhea, chlamydia, and syphilis as well, because we know they go hand in hand. We're really trying to forward think. We're already looking at partnerships on places we can go to take the mobile unit. We want to be out. The mobile unit is called McGregor on the Move, and we want to be on the move.
I like it. And so we have events like ML King Day or the Edison Light Festival, unless you want to do black stuff. But we have all these different types of things that happen. That van can be right there, just like those other things that you can walk in.
Yes.
When I come out of the movie theaters, this is not part of this, I just want you guys to get. When I come out of the movie theaters and I see those blood trucks out there, say give some blood or what have we, are they screening for HIV as well?
They do. They do it through a different process. They don't do the same type of counseling that we do that goes with it, but they do have to screen the blood supply. That's how we ensure that blood transfusions are no longer a means of transmission.
They're not there for that. They're there to collect blood, but along the way that happens. Right?
Correct.
Okay. So they do a quick test right there on the spot, or they take it off and...
No, they take it to their lab, and they actually screen multiple times.
Okay, see, bringing in that human stuff, you can relate to that. What's happening on the 27th, David?
27th is National HIV Testing Day, and we will be at Walgreens located at 3593 Cleveland Avenue doing testing throughout the day. And again, it is the rapid testing, so it only takes 15 minutes to get the result. And then back at our office, McGregor Clinic, which is located at 3487 Broadway, we will have a lunch and learn moment from 2 o'clock till 3 o'clock p.m. where the general public is invited to come in and learn about the importance of being tested for HIV.
Final question, Amy. Getting tested in public, are people still trying to be private when they get tested, or they just want to be private when they are diagnosed with the virus? And how do you guys at McGregor Clinic go about this whole privacy process?
What we find is because of the stigma surrounding HIV, people want privacy, they want confidentiality. And so we take that very seriously. We try very hard not to use interpreters even. So I'm fluent in Spanish. We have staff that's fluent in Haitian Creole, really trying to make it a one-on-one experience. The records are actually the Florida statutes indicate that they're super confidential, so they have even more laws attached. We take HIPAA to a whole nother level because we want to make sure that people are comfortable. McGregor Clinic is a safe space where people can come, be themselves, talk about their sexual history, their drug use history without judgment. We're there to make sure that they stay safe from HIV.
Well, it's great to get both of you here again. Keep up the good work. And Leapers Live, of course, will be coming out to McGregor Clinic in the future, taking some shows. And for those who say it can't be done, they're usually interrupted by those like David and Amy and all the fine people at McGregor Clinic who are doing it. We'll be right back. We'll get a chance to find out what's going on. Girl Talk, Tashika Payers here.